Hi, I'm Alex Trejo.
Hi, I'm Sophia Ortega.
Hey, I'm Kevin Reyes.
Hi, I'm Stephanie Rivera.
Hi, my name is Kiara Guaya, and we'll be discussing how there has been an increase in mental health issues during the pandemic, directly caused by quarantine. We decided to film a public service announcement since it is the safest way to spread our message across a large platform and potentially reach those who are struggling with mental health issues on their own and in their own home. Last year, a survey was conducted between April and June asking the participants if any of them had experienced any mental health issues, such as anxiety or depression. 11% said yes. This year, the same survey was conducted in the same time frame. However, this year, the time frame was in the beginning of quarantine. 30.9% said they experienced anxiety or depression. 54% of these were essential workers. And 13.3% reported a started or increased substance use to cope with stress or emotions directly caused by COVID-19. And of these people, 10.7% of them reported considering suicide within the last 30 days before completing the survey. All of these are increases compared to last year and caused by the COVID-19 pandemic and quarantine. Next, Kevin will discuss the history and the cause of the issue.
The U.S. reported its first case of COVID-19 in January, and 2 months later in March, the country went into quarantine. Strict stay-at-home orders kept many people at home for months, while essential workers were forced to adapt to the new norm to try to remain safe. People went into a state of panic. Masks became political, toilet paper ran out, and what some thought would be a 1-month ordeal has now entered its 7th month. Whether it was the handling of the outbreak by the U.S. government or the uncertainty of the future in regards to jobs and schools, we have had no shortage of issues to deal with. That is why taking care of our mental health is so critical in getting through this pandemic. Times are tough, and we don't know what's going to happen next. However, what we can do is look out for one another to help us get through this. Now, here are some resources that can help us do just that.
So my resource comes from inglewoodhealth.org, mental health tips and resources during COVID-19. So the first tip they give is maintaining a physical well-being, so a healthy physical well-being. So that can include getting enough sleep, exercising, and eating well. All these things help your body physically and mentally. What you put into your body is what your body gives back out. So exercising, eating healthy, and getting enough sleep really does help your brain and also your body physically. And then also meditating and practicing positive talking to yourself. A lot of times human beings are really negative towards ourselves just because it's easier to be negative than positive. So talking positive is a good thing, and getting the wellness app and turning off your phone. So the phone number that I have here is the National Suicide Prevention Hotline. The phone number is 1-800-273-8255, and they're open for calls 24/7 whenever you need to call them if you ever need help.
All right, my first resource I will share with you guys is a website that is reliable and credited by the government, and their headquarters is in Washington, D.C. Their website is called hhs.gov, and they explain how people cope with mental health issues differently, especially during this pandemic. First, people should avoid drugs and alcohol as a way with coping with mental health issues because this can often worsen the situation. Second, people should try wellness programs such as yoga, meditation. This could take your mind off thinking negative. Third, people should stay connected. By staying connected, that could either mean by going outside, having a chat with your neighbor, or calling your relative or loved one, or even having a Zoom call with a friend. Usually that helps with depression, anxiety, or suicidal thoughts. And my last resource I will share with you guys is called Mental Health America Hotline. Although they don't provide direct services themselves, they will help you find resources for you or your loved one. And their phone number is 741-741. They operate 24/7. All you have to do is simply text MHA to that number.
And my last resource to offer you guys is from Michigan University Health. This website gives you a whole list of resources and ideas that could help you with your mental health throughout this pandemic. The first one is Worry Drop. So basically, that's when you get a journal and you write all your fears and worries that are causing you maybe this anxiety, depression, any of that can trigger your mental health. And by doing this, you can just write all your feelings down instead of maybe not being verbal if you're not like that type of person. And second is taking care of your body. This is just in general, working out, going for walks, stretching, taking deep breaths in and out of the day are still really important to your physical health, but also to your mental health because it gives you a chance to step back and take a breath. And then lastly, I'm going to give you another resource. It is the National Institute of Mental Health, and it's open from Monday to Friday from 8:30 to 5 p.m. and the phone number will be listed right here. And this is a great resource if you just need some additional support for your mental health and also to just give you guidance. And lastly, we hope to accomplish this video by bringing awareness of the mental health during COVID-19 pandemic and to share the resources that can help others while in quarantine. In the midst of managing the situation in the COVID-19 outbreak, it's really easy to feel overwhelmed and worried, but focusing on the slow of the spread of this virus is important for our physical health. However, identifying ways to manage our mental health is also very critical as well. Stay safe.